Hi, I'm Dr. Kent Washington. I'm an orthodontist at Washington Orthodontics. I've been practicing for 12 years.
Hi, I'm Dr. Brian Hahn. I'm a pediatric dentist. I have been practicing for the past 10 years. The ideal time to bring your child to a dentist is about 1 year old. I think it's really important to start early and get the habits established and get that relationship going with your pediatric dentist to set your child up for success in oral health.
So the American Association of Orthodontists is usually going to recommend about 7 years old. A lot of people will remember the term 7 up. It's a good way to remember. Typically at 7 years old, a lot of that appointment is getting established with an orthodontist. I generally tell parents that there's 3 different ways that appointment goes. One is getting established with the orthodontist. The other is sometimes we need to help guide eruption of adult teeth. And so maybe we'll refer back to you for extraction of baby teeth, things along those lines. Every once in a while, we will do what's called interceptive or phase 1 orthodontics. That generally just varies by what's going on with that particular patient.
Correct. And that's often when the permanent teeth are starting to come in and the kid's mouth is changing actively. They're losing teeth, getting visits from Tooth Fairy. And that's when we contact Dr. Washington and start asking questions about, eruption guidance and growth and development, which Dr. Washington is phenomenal in what he does. And so we rely a lot on him to get the best care for our patients. Parents are more than welcome to bring their children in before that 1 year old. Typically, based on the American Academy of Pediatric Dentistry recommendations, we recommend parents bring their children in to see us within 6 months of the first eruption of the tooth. The first eruption of the baby teeth usually happens in the bottom front, and that usually happens somewhere between 5 and 7 months of age. So theoretically, that parents are able to bring their kids in to see us at that time, and that is actually a great thing. Often this is something that the parents don't often think about, between being completely sleep deprived and then have so many things to juggle. But I think it is a very important thing to keep in mind to get that early start. Now, I'm going to also say that some kids are born with teeth, and in that situations, then it is absolutely the right thing to call your pediatric dentist or get in touch with your pediatrician to get the right recommendations to get the child in to be seen, to make sure that those teeth that have come in prematurely is something that can stay in the child's mouth.
Maybe you have a 6-year-old who's getting teeth extremely early, or you have issues where we're looking at an x-ray and we notice that, oh, this person's going to be missing, a number of permanent teeth. And so we know that it's going to be a long road as far as orthodontics, dentistry, pediatric dentistry, all these different things. So in those cases, we will see them generally that early. Most of the time, though, the earliest that we'll really get anybody in is about 5 or 6. And generally that is a situation where we're just monitoring.
As a pediatric dental specialist, I work with several of my colleagues, and we have a great team in my practice at Carolina Children's Dentistry. We are all specialists who have undergone extra training to care for your child, and we are the pediatricians of the dental world. So we are equipped with the knowledge and the technology and the experience to care for your child's super early needs. So as they grow older, we are also screening for proper growth and development. Now, when they become about 6 and 7 years of age, as we are helping them see and then helping them guide with their eruption sequences as they're coming in, making sure they're coming in correctly, if they have all their teeth that they need, as well as treating cavities. If we see any issues, that we will refer to Dr. Washington for his expert opinions in how they should be. So as much as we like to see the teeth are coming in straight and beautiful at all times, but oftentimes that's not the case, and that's why God made orthodontists, right? Right.
the reason our relationship works so well is that they might notice something that is skeletal in nature as opposed to the teeth just not being straight. Or they may notice a bite issue that's going to cause damage to the teeth long term. And a lot of times parents tend to focus on how the teeth look, right? And so you do have those parents that come in and they say, hey, I've noticed their bite is off. I think I'd like to see an orthodontist. But where Dr. Brian comes in a lot is he'll say, hey, there's something that maybe you haven't noticed. There's maybe a growth and development issue here. And what's nice is that when we see a patient like that, he's right, you can come in and do interceptive or phase 1 orthodontics. Essentially what that is when a patient comes in, and let's say the patient comes in and they're 8 years old, and they have something going on that's a growth and development issue. If you allow that issue to sort of fester and you just decide, well, hey, I'm gonna wait until all of their adult teeth come in. Sometimes, especially in females, you know, females are done growing 15, 16. And so they come in and now it's sort of set and that issue is much harder, if impossible, to fix at that point. So what we do is when we come in early, what we'll say is hey, let's go ahead and let's address this main concern. Let's fix this issue. We're not gonna do a full set of braces yet. We're gonna fix this main issue. We'll take them off and then we'll revisit braces later at the appropriate time.
Carolina Children's Dentistry of Columbia is conveniently located where I-20 meets 77. We are off of Two Notch Road at the address of 7701 Trenholm Road Extension in Columbia. We can be reached by phone, or you can get to our website and then submit a form so we can reach back out to you. We would love to see you and your child at our practice.
And so we are conveniently located right across the street at Washington Orthodontics. Our address is 7621 Trenholm Road Extension. And the best way to reach us is either via our website or you can give us a call at 803-699